Liposuction application provides the removal of locally accumulated fat that cannot be destroyed by itself. Liposuction, which is applied to remove the permanent fat accumulated on the regional scale, is performed with small holes without incision. During the application, tiny holes are made in the areas where the fat accumulates, and the excess fat is removed with the help of cannulas. After liposuction, patients will have more proportional bodies. After the application, patients will need to keep their regular diet and exercise in order not to gain weight again. People who request liposuction get rid of their accumulated fat after the application. Since anesthesia is applied to the patients during liposuction, the procedure must be performed in a completely sterile and equipped operation room. Considering the additional treatment required before and after liposuction, endomology treatments that increase lymph drainage and LPG are very beneficial for the patient. In addition, the patient's self-massage to the relevant area during the process can increase the speed of recovery. Considering the complications that may be encountered after the liposuction operation, bleeding and risk of infection, however, it is an operation that will not cause serious bleeding. It is possible to see bruising on the 5th day after the operation. If redness, fever, or swelling is observed, then it should be considered as an infection. In order to clear the infection, antibiotic therapy is administered. There may also be skin loss, albeit very rarely. This complication may be encountered if a second fat removal operation is performed on the same area and the area is concentrated. Smoking should be avoided for 2 weeks before and after the surgery. Otherwise, the risk of skin loss may be increased. People who will have liposuction should first consult a doctor who is an expert in the field. Liposuction is an ideal method for people who want to lose weight. People with obesity problems cannot lose weight after liposuction. After liposuction, there is no possibility of getting rid of the fat in the whole body, provided that it is limited to the determined areas. Liposuction is applied for the fats that cannot be burned despite the applications of the patients. After liposuction, patients gain weight again and experience lubrication in the same area, while the methods specified for liposuctions allow the resistant fat masses to be broken down and removed from the body. If the patients continue with the same lifestyle, there is fat mass formation again. People with excess weight problems should first apply to a dietitian and get regular nutrition and sport habits to burn their excess weight. The regional fat masses that cannot be burned after proportional. Since skin elasticity will disappear spontaneously due to advancing age, people who are too old are not allowed to have liposuction. Whether or not the liposuction is harmful depends on the procedure. If more oil is not taken than required during the procedure, in this case no harm is encountered. However, if people who have unless process may not work unless they pay attention to their lives. Therefore, it is possible that they may be disappointed because they cannot maintain their weight in the long run. During the recovery period of liposuction, special corsets prepared for the areas where fat is removed should be used. In liposuction application, the fat masses accumulated in the area are broken down and thrown out of the body. In order for the fat masses in the treated area to gain volume, it is essential to use a corset after the surgery. The wearing time of the corsets to be used will vary between 4 and 8 weeks, depending on the size of the fat removed by the people and the area where the operation was performed. After the liposuction application is completed and the patients are taken to the room, ice massage should be applied to the application areas. During the first 24 hours, it is necessary to continue the ice massage at 15 minutes intervals. During the first 10 days, edema and bruises will occur. At the surgical sites, special creams should be used to eliminate edema and bruises. Not moving the area and not making heavy movements that will force the area helps the early disappearance of edema and bruises. 7 days after the operation, the sutures in the place where liposuction is entered are removed. Within 3 weeks after liposuction, patients are allowed to return to their daily lives. Individual exercises can be continued within 3-4 weeks, provided that they are not too heavy. Oral painkillers are used to relieve pain and aches in the application areas.